I'm very pleased that we have just got in the genome sequencing results, and they have shown clearly that this was not a variation of the virus that was locally acquired. It would appear to us at this stage that the virus that has caused the case yesterday on our 26th day is most likely to have been picked up in possibly the hotel and possibly from aircrew. But we're working through those. There's still more work to do by New South Wales Health. So the good news is, whilst we announced one case yesterday after we'd had 26 clear days, we've now had another day with no additional community cases, and we've also know now that that case that we announced yesterday was not related to any virus variations that are currently moving through the community. So, important message: the virus is not part of our locally transmitted viruses. It would appear it's come from overseas. We've got more work to do to work out where it's come from, but highly likely it came from possibly the hotel or possibly aircrew that, of course, can stay overnight, stay for a few days before they turn around and go back overseas. We'll do some more work and we'll report back to the community, but it's extremely good news for all of us in health and all of us in our New South Wales community.
Big relief.
I literally was just told a minute or two ago about this outcome, and it's massive relief from my point of view as Health Minister. But we still have work to do. We still have to try and work out which aircrew or which other person from overseas, possibly in the hotel, did manage to transmit it and how it got transmitted. So we'll work on that, but definitely not a locally transmitted virus.
And we have seen the high infection rates going up across the world.
Yep.
And we are starting to see this creeping from the hotel quarantines into the community, like what we saw in South Australia. What else can be done to ensure that the people that are manning those hotel quarantines aren't infected?
Look, New South Wales is, as the Prime Minister and many others have said, gold standard. But there is always a risk. As I said yesterday, as the Premier has said in the past, if we're having returning travellers coming in from some of the most virus-infested countries in the world, you have to expect that on occasions we might have some challenges. But as long as we can trace, we can track, we can isolate, and that's what our gold standard health teams do, it removes our worries.
In regards to those, all the trains that were listed yesterday, Minister, there's nothing to come from those at this point?
The health team is currently reviewing whether or not we need to continue with the advisories for people carrying on. The health team is currently reviewing whether or not we need to have any advisories for people on the trains, but it would be very likely that we can actually lift that advisory later today.
3 weeks ago, National Cabinet announced that we introduced weekly testing for workers at police-run quarantine hotels, but it's yet to be implemented.
No, all staff in the police hotels are actually screened weekly.
But in a statement from Health, they said that they're still working with police to implement the National Cabinet's recommendation in regards to routine COVID testing as people working in these hotels.
There is routine weekly screening, and of course the determination then is whether or not they need to have a COVID test, and those aspects are being worked through at the present time, but everybody in the police hotels are actually screened weekly. Well, that's the advice from Dr. Chant, and Dr. Chant has given us good advice so far, so I'll rely on the advice from her and we'll get some more advice on that later.